Hi guys, we're going to go through a really simple exercise that I actually do, I prescribe to a lot of my patients, particularly those who are runners, who potentially have had problems with lower back pain or particularly issues in stabilising their pelvis when they run. And sometimes the problem is actually, if we turn around and look in the mirror, sometimes what happens is when people run, they might just drop down through the pelvis like that. So if I tuck this one in there, okay, when they're standing on their right leg, sometimes they might just drop down through the left side of the pelvis. And then when they come onto their left leg, sometimes they might just drop down through the right side. And that sort of sway from side to side, a lot of the time can cause pelvic instability, can cause lower back pain, can cause lots of different problems. But we're going to go through an exercise that I tend to recommend for those particular runners. And it's a tough one, it's not an easy one. But the way we do it, let's just bring you out a little bit so you get a bit of better angle. Okay, so just through there. And by no means am I perfect when I do this, but it's something I try to work on definitely. Okay, so what we do is we try and go into that single leg stance with one leg in the TRX, drop down into that lunge position, and then come up into the running position. So the arms swap over just like how you're running, but really what I'm trying to do here is just make sure my pelvis stays nice and horizontal. Okay, so instead of dropping down like that, when I'm standing on my left leg and that right hip drops down, I'm trying to keep this nice and horizontal, whoops, wrong one, and just come up through there. Okay, and then of course just swap over, set left leg into the stirrup, okay, into that lunge position again. So I'm coming down with the left leg, my left arm comes up, coming up with the left leg and my right arm comes up. Okay, nice and simple. But yeah, as I said, obviously if you're experiencing any pain when you do it, then stop. But if you try and include that into your leg session, maybe at the end when you're a bit fatigued already, and you have to concentrate actually on the alignment of the pelvis, you're going to find it pretty good. All right, take care guys, and bye-bye.